I was just living my life, avid outdoorsman, and, I was with the Marine Corps and, working and going to school, trying to, become a firefighter, and everything was just going as planned, nice and smoothly.
We've been dating for about 4 years, and we just got engaged, and we're planning our wedding for 2023.
One day it just started with a limp and a little bit of pain. I started limping and then it goes away. And then a couple weeks later it comes back, and I thought just a small strain.
We're in our 20s. We didn't think anything like this serious could be wrong with us. So we started out at a primary doctor. We were sent to an MRI. They basically told him he had like a muscle strain, torn tendon. They told him he'd be fine, but then things started getting worse, and so I had him go to Rush and Aurora at the ER, and after they viewed all his imaging, his CT, his MRI, his x-ray, and then they also ran new MRI and CT. I had reached out to a surgeon that did my hand surgery, and he had recommended us to Dr. Blank, and then when we went to Castle Orthopedics, they had also recommended us to Dr. Blank.
When I first met Kevin, he came in with a significant amount of hip pain. We got some imaging and we saw that there was some sort of a mass in his hip area, and biopsy showed it was unfortunately a Ewing sarcoma, which is a type of cancer.
My reaction, well, it wasn't really something that, really hit me hard.
Oh, I cried. I cried for like 2 months.
As soon as it hit me, I'm like, all right, let's get going. When's the first chemo?
And I think that's what really helped him throughout this whole process, was him being so positive and not looking down on his situation.
So Dr. Blank pretty much recommended me to Dr. Mittal, the pediatric oncologist who would be taking care of me.
The first goal is to try to, shrink the tumor to make the job of the surgeon easier, which would involve upfront chemotherapy for about 12 weeks, after which there would be a consideration of whether we want to do surgery versus radiation, because Ewing sarcoma is also sensitive to radiation.
Ewing sarcomas in general are very rare diagnoses, only a few hundred of them every year in the United States. Additionally, having it in this location is quite rare, so it makes it a challenging problem of how do we deal with the cancer in the hip surgically. There have been a number of procedures tried before throughout the country and the world to remove these tumors and reconstruct or rebuild the hip that has to be removed with the tumor. Many of those procedures have high complication rates. Here at Rush, we've been performing 3D printed pelvic reconstructions with 3D printed implants, and we've been doing them quite successfully for a few years now, and we believe that Kevin was a very good candidate for this. We can actually 3D print a perfect match of basically a new pelvis made out of metal that can then be implanted in that same exact spot. I think 3D printing is not only the future, it's the present. Many fields in orthopedics as well as cancer are really utilizing 3D printing technology.
After all the discussion and the review, I think our team was fairly confident that with this new approach that Dr. Blank was using, he would be able to get rid of the remaining tumor after chemotherapy, and then also give him an excellent chance of function.
By doing the surgery, because it was localized and not metastatic, they were taking out the bone that included the cancer and the cancer in the soft tissue, so they were removing it completely from his body.
The surgery takes anywhere from 6.5 to 9 hours in total. It involves 3 or 4 different surgeons and really a significant planned effort. Many of us spend hours for the few weeks running up before the surgery. We go through our technique to make sure we're all on the same page, and it's really a multidisciplinary team effort to get it done.